In this video, I'm going to show how to get instant nerve pain relief in your lower back and legs. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over easy exercises that can give instant relief for nerve pain in the lower back and the legs, specifically sciatic-like symptoms. A note about these exercises, each one works just a little bit differently. They're going to focus on different positions, different causes of nerve pain in the leg. To get the best results, go through them all, use what gives you the most relief. With that being said, let's get started. Here's a couple easy exercises that you can do in bed or on a floor. These are going to focus on quickly taking pressure and tension off the sciatic nerve pathway. So let's start off by getting in position. We're going to lie flat on our back, have our legs roughly hip width apart, knees bent, feet flat. Take your hands, put them right on your hips. This first movement is called the pelvic rocker, and it's going to target the lower back, the hips, and the butt area just a little bit more. So just like the name implies, you just want to rock your hips and pelvis forward and backward. But let's break it down to make it a little bit easier. First thing, you want everything nice and relaxed. Don't try to tense any muscles. We're trying to take pressure off, not build it, so don't tense anything up. From here, I just imagine my tailbone right here, and I just curl it upward towards my belly button and towards my spine. You should feel a gentle activation of your hamstrings right here on the back of your thighs that works into your glutes, the buttocks, that goes into the hips towards the lower back. Once you feel a gentle activation of these muscles, and you only want a gentle activation, not a deep stretch, you hold this for a couple seconds and then go in reverse. So this time around, imagine your tailbone and just pressing it down into the bed or the floor. Hits the muscles just a little bit differently, but rock forward and backward about 10 to 15 times. And with each repetition, try to build into it just a little bit more. So if you are having a lot of nerve pain or sciatica going down your leg, even towards the foot, to take this one to the next level, you can add in a flossing movement. So whatever side that you're having the most amount of pain, let's say it's your right side, what you're going to do is lift that leg up, have your knee bent roughly at 90 degrees. Take your hands, grab right behind your knee, right on the back of your leg. What you're going to do from here is just gently and slowly pull your knee towards your chest until you feel a gentle, but not deep, just a gentle stretch right here on the back of your thigh. Hold this and now slowly straighten your knee, taking your foot towards the ceiling. This will quickly intensify this stretch, so build into this one really, really slowly. Once you feel a deep but comfortable stretch now, you're going to hold this for about 3 to 5 seconds. Relax. On the next repetition, you're going to notice that you just have a little bit more range of motion to be able to build into this. So keep doing this over and over again for about 10 to 15 repetitions. But to take this one to the next level and focus a little bit more into the calf, even towards the toes, what you can do is this. Build back into the original stretch, so straighten your leg out like this, but now take your foot and press your toes away from you, kind of like pressing into a gas pedal. You're going to feel the calf and those muscles and tendons really start to fire all the way towards the toes. Hold this for about a second and then go in reverse, bringing your foot back towards you. But do this over and over again for about 5 seconds. Relax and then repeat this over and over again until you're not getting any more improvement. But go through all of these movements. You're probably going to find that one just helps you out a little bit more. At that point, throw more repetitions in. So let's move on to another exercise that you can do in bed. This one is going to focus a little bit more on what we call piriformis syndrome, which is a muscle injury that can compress the sciatic nerve pathway, leading to a lot of pain across your buttock towards the back of the thigh. It usually comes about from sitting for too long. So let's start off lying flat on our back, whatever side that you're having the most amount of pain. Again, let's say it's your right side. Take that side's ankle and place over your other side's knee. So when you look up, it should look like a figure 4. What we're going to do next is take this bent knee and slowly press it away from us. Don't use your hands, but instead use your leg and hip strength. The more that you press away, the more that you're going to feel a really good activation of the muscles around the hips, including the glutes and the piriformis muscle. Go for a deep but gentle activation of these muscles and then hold this for 3 to 5 seconds. From there, just relax and repeat this 10 to 15 times. And with each repetition, try to build into it just a little bit more. To take this one to the next level, we can add in a rocking motion to hopefully loosen things up to get more pain relief. So what I'd like to do is just gently press my knee away from me, hold this, and then kind of like a windshield wiper, I go down towards one side, focusing on moving through my hips and my lower back until I feel a gentle stretch in my lower back. Hold this for a second or two and then rock towards the other side. And then just keep repeating this a couple times in both directions and then relaxing. And then I'd like to do this whole cycle for about 3 to 5 times. But again, go through all of these movements. You're probably going to find that one just helps you out a little bit more, like maybe just rocking a little bit more towards your right. At that point, try to throw some more repetitions in until you're not getting any more improvements. Let's go over a couple exercises that you can do right in a chair. This first one is called the slump stretch, and it's going to focus on reducing tension and pressure on that sciatic nerve pathway going all the way to the foot. To get into position, we're going to start right at the edge of a chair and just have very good upright posture. Have your back as straight as possible. Whatever side that you're having the most amount of pain, let's say it's your right side, straighten that leg out at your knee like this and just gently press your heel into the floor until you feel the glutes, the buttocks right around the hips start to fire. We're going to hold this, and now what we're going to do is take our foot and press it away from us as much as we can, kind of like pressing into a gas pedal. As you do this, you're going to feel the muscles throughout the whole leg start to fire, and it's going to work pretty much towards your thigh, into the hip, into the lower back. I like to press into this until I really feel it in my hip and lower back area, and then I hold this for a second or two and then go in reverse, bringing my toes back towards me. You're going to notice it hits the muscles a little bit differently. Again, hold that for a second or two, and then you're just going to repeat this over and over again for about 10 to 15 repetitions in both directions. Just a nice, slow gliding motion. So afterwards, at this point, everything should be warmed up, and now we can build into our slump stretch, which is going to be a lot more intense. So this time around, what I'm going to do is bring my toes back towards me as much as I can until I have a really good activation of the muscles going all the way up towards the hip and the lower back. Once we feel that, we're going to hold this, and now we're going to slump forward with our shoulders and our head. So I just kind of like to take my chin towards my chest, and then I just round my shoulders forward, slumping forward towards the floor. Do this one slowly, because the more that you slump into this, the more intense you're going to feel a deep stretch going all the way towards the calf into the foot. Hold this one comfortably for 3 to 5 seconds and then come back up. On the next repetition, try to build into it just a little bit more and try to do this about 5 to 10 times. But if you feel like it's helping out, you can definitely throw more repetitions in. Moving on to this next seated exercise, this one's going to target a little bit more into the piriformis muscle. This one again is caused from too much sitting, so if most of your sciatica is felt from being in a chair for too long, give this one a try. What you're going to do is take the painful side and place that side's ankle over your other side's knee. So when you look down, it should look like a figure 4. I know a lot of people are going to have difficulty getting into this position. To make it a little bit easier, just straighten the other side's leg out like this, put your ankle over the other side's shin, grab your pant leg or in front of the shin, and then slide it up into position just like this. So the first movement, what we're going to do is take this bent knee and just slowly press it towards the floor, but don't use your hands. Instead, use your leg and hip strength. The more that you press down, the more that you're going to feel the muscles around the hips start to activate, including the piriformis. Once you feel that, hold this comfortably for about 3 to 5 seconds and then relax. Repeat this 10 to 15 times, and with each repetition, try to build into it just a little bit more. So to take this one to the next level, we can add in another movement that's really going to intensify this exercise. So let's build back into that original movement of pressing our knee down as much as we can, and then we're going to hold this. Now, keeping your back straight, so we're not trying to round into this one, you're just going to slowly lean forward, taking your chest towards the floor. The more that you lean forward, the more that you're going to really feel it around the hip. So build into it slowly and then hold this comfortably for 3 to 5 seconds. But if you feel like that movement is offering a little bit more relief, I would build into this one instead. Here's a couple standing exercises that can offer quick pain relief. These ones are going to focus on taking pressure off a bulging or herniated disc that can cause a pinched nerve leading to sciatica. The first movement is called standing back extension, really easy to do. Take your hands and cup around your waist above the belt line and press your thumbs right into the muscles off to the side of the spine. What you're going to do from there is then take a wide stance with your legs and place all of your body weight onto your heels. Gently press your thumbs and hands forward into your lower back while leaning backward at the same time. Do this one slowly because you're going to feel a deep stretch form in the lower back. Once you feel a gentle, comfortable stretch, you're then going to hold this for about 5 to 10 seconds, and then from there, just relax. On the next repetition, we're going to take this one to the next level by just going up a level. So move your thumbs up about 1 inch and then repeat. You're going to notice it hits the lower back just a little bit differently, but keep repeating this over and over again across the entirety of the lower back until you find that one certain spot that just offers the most relief. Like let's say right here for me. At that point, you're going to stop over that spot and then stretch into this for 20 to 30 seconds and just do nice, slow, controlled breathing, release it, and then throw in a couple more repetitions. It's a really good exercise that you can use throughout the day. The next movement is called a wall lean exercise. For this one, we just need something that is sturdy enough to support our body weight that we can lean into. So a door frame works or a wall. The hardest part about this exercise is just knowing what side to place close to the door frame or the wall. Remember, the good, non-painful side is going to be close to the wall, painful side is away. So I'm going to demonstrate what to do if you have right-sided leg pain or sciatica. Place your feet together, spaced roughly about 1 foot, 1.5 feet away from the door or the wall, and then you're just going to lean your upper body weight and shoulder into that door frame so it's kind of tilted or leaning. From there, you're going to take the hand on the painful side, place it right on that painful side's hip. Now slowly press your hips towards the door. As you do this, you're going to feel a really good stretch form in the lower back and across that hip. So keep building into this one until you feel a gentle, comfortable stretch, and then hold this for 20 to 30 seconds. And again, do nice, slow, controlled breathing. From there, release it, relax, and then repeat this 3 times. And with each repetition, challenge yourself by building into it just a little bit more. If you would like a deeper stretch, all you have to do is space your feet further away from the door frame. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.